now time to introduce Robert Skeen. Robert Skeen has traditional ties to the Gabby Gabby of the Queensland Sunshine Coast, the Munanyali of the southeast Queensland, and the Wananyi of northwest Queensland. He has worked in government and Aboriginal community-controlled and health organisation sector for almost 25 years. 15 of those years he led an organisation and sat on governance committees in the Northern Territory, Queensland and New South Wales coast. Robert was CEO of Aboriginal Medical Services in these three states a total of 7 times. He was a member of the AH&MRC Health Research Ethics Committee, one of only 3 of its kind in Australia, and was also a member of the New South Wales Working Party for the National Aboriginal Community Controlled Health Organisation, NACCHO, Constitution Reform. Robert will be speaking and celebrating ACCHS responses to the COVID-19 pandemic. Thank you, Robert.
Hi everybody, my name is Robert Skeen. I'm talking today about resilience in healthcare, and in particular celebrating our Aboriginal community controlled health services response to the COVID-19 pandemic. I'd just like to acknowledge the Bidjigal and Gadigal clans who traditionally occupied the Sydney coast, and pay respect to our elders past and present. I'm speaking here today from Biripi country, up just out. And just as an overview of what we're going to be covering today. So just a brief introduction to the Aboriginal Health and Medical Research Council of New South Wales, or the AH&MRC as everybody knows us. We are the Aboriginal Community Controlled Health Services in New South Wales. There are 46 member services, and they include Aboriginal Medical Services, Drug and Alcohol Residential Services, Link Up, and other social and emotional well. The board approved a new regional model which was endorsed at our AGM in late 2019, and there are now 4 regions that our member services into across New South Wales, and they're North, South, West and Metro. An Aboriginal community controlled medical service is made up by, so our board of governance, board of directors is elected from the community, and they set the strategic direction and have stewardship organisations. So preparing for the COVID-19, proactive. There, in 2019, with the H1N1 swine flu, there were unequal burden on Aboriginal people. Aboriginal people disproportionately have swine flu in greater numbers than non-Aboriginal people, with higher mortality and higher morbidity. In 2018, the AH&MRC board requested the incoming PH to take a proactive approach to public health emergency preparedness. Discussions commenced with the New South Wales Centre for Aboriginal Health and the Health Protection Leadership Team, which was public health unit directors from across New South Wales. On the 4th of 2020, the AH&MRC's team returned to work from the Christmas break, and we're very aware of the new news coming out internationally of a viral infection. At this stage, community was not dynamic, and there was no strong messaging in the mainstream media. The AH&MRC knew from experience previously with the swine flu that this was potentially very serious and were significantly worse for Aboriginal people than non-Aboriginal people from the swine flu. Even more concerning was early evidence indicated key people at risk from COVID-19, people living with existing chronic health conditions, and healthcare workers. For our community, we knew we had to act fast and do all we could to ensure all our community members were and safe. As the community wasn't talking about the oncoming pandemic of the COVID-19, we recognised early on that we really had to prepare a readiness kit for the pandemic, and the best way to do that was to prepare a influenza season toolkit. Then this wouldn't cause panic and anxiety amongst the community. So yeah, developing that toolkit really helped them to prepare. In February, the AH&MRC developed our own internal COVID-19 response action plan. This guided all actions of the AH&MRC throughout the pandemic. The overarching goal on the action plan was to keep all of our member services open so that the community would have the best chance of staying safe from and also having an uninterrupted access to culturally safe, comprehensive primary health care. So our internal COVID-19 response plan had 8 main priorities for action. 1 was to protect the AH&MRC staff. 2 was to protect the AH&MRC students in our Aboriginal Health College. 3 was to ensure Health and Medical Research Council staff and member services have good access to information and resources relating to COVID-19. Number 4 was ensure New South Wales Aboriginal has good access to information about COVID-19. Number 5 was to support member services to be ready for and respond to the pandemic. 6, promote Aboriginal community control governance and business continuity to a timely way to emerging concerns. And 8, coordinate and manage the AH&MRC response. We focused on all times on Aboriginal definition of healthcare. It calls for not just the physical well-being of an individual. We focused at all times on an Aboriginal definition of health that calls for not just the physical individual, but refers to social, emotional, and cultural well-being of the whole community, in which an individual is able to achieve their full potential as a human being, thereby bringing total well-being of the community. This means that a range of activities for our COVID-19 team focused on were really wide-ranging. Pandemic Preparedness Toolkit guided members on how to prepare and respond to the pandemic. We encouraged all members to nominate a pandemic coordinator. The team was established in March and has continued meeting regularly until now. The AH&MRC meets regularly with a broad range of stakeholders, including our member services, Aboriginal Community Controlled Health Organisation, or NACCHO, which is our national peak body, other affiliates from across Australia, Department of Health, New South Wales Health and the Centre for Aboriginal Health, New South Wales Rural Doctors Network, and other NGOs. And these are just some of the resources that are available on our website, including, some really informative short bits from Dr. Calvin Kong. And these are really key on getting the important messages of COVID out to our communities and our members and helping them to support. Consultation with members guided our activities. A big thank you to the New South Wales Rural Doctors Network for workforce shortages where they were existing. Our business development team helped members access grants and funding opportunities to help with other shortfalls. Telehealth use increased dramatically during the COVID-19 pandemic. The AH&MRC and the New South Wales RDN supported members to increase their capacity. PPE, as we all know, was a global issue. There were many webinars and online training available, and all our staff worked from home. Maintain regular meetings and networking to assist our members. Working with the Department of Health and New South Wales Health to find testing solutions. Our goal is for every testing within 2 hours of drive. The AH&MRC cultural group also played a key role in developing this. So as you can see from the outcomes and impact, we were 1% of all cases Australia-wide. Same in New South Wales, where we only had 31 cases. Well, there were 102 deaths across Australia. There were none for Aboriginal and Torres. Our community action plans drive local responses. And because of this, we now have strong confidence in our sector regarding capacity to respond to. So from these the graph showing the testing rates, our Aboriginal community-controlled health sector has played a key role in promoting, facilitating and delivering testing. The Aboriginal community-controlled health sector was able to slow the spread and protect community from the first wave. Slowing the spread helped reduce the impact through the hospital system was not overwhelmed. Ongoing delivery of comprehensive primary health care by the Aboriginal community-controlled sector will minimise impact of chronic health conditions. Future challenges is to minimise impact of the fourth wave and the impact on the social and emotional wellbeing of our members and community. This is just one of our success stories from our sector. Within weeks of receiving supplies of the annual flu vaccination, the Wellington Aboriginal Corporation Health Service, or WACS, 700 vaccines to the local community. The clinic doctors and staff worked above and beyond to administer the 700 plus vaccines. The clinic was also opened on Good Friday to assist working to find time outside their regular clinic hours to get their flu shot. Delivering flu vaccine clinics during the COVID-19 pandemic is more complicated than clinic staff managed new clinic spaces in the car park to adhere to social distancing rules and reduce numbers into the clinic. Personal protective equipment with local police to ensure people driving to get vaccinated would not be fined. So I just got a quote from Jay Foster, the team leader of Healthy for Life. See from the high community uptake that the word is spreading through about how important it is to get your flu shot every year. It is surprising how many people are getting the flu vaccine. We are proud the community is doing the right thing to stay strong and protect our elders and those with chronic health problems this flu season. So another success story. Before I came into this role, I was the CEO of the Birrapai Aboriginal Medical Service in Taree. We had to find a way to maintain our services to the community, keeping the staff safe as well. So while we physically closed down our services, we maintained the service delivery through telehealth and the support and hardware from the Rural Doctors Network. So as it says, all our appointments were over the phone in the mornings, referred to the GPs, and the GP made a decision on how urgent it was and whether they just needed a script or visit to the hospital, or if there was an urgent case, then an appointment would be arranged for a face-to-face in the afternoon. We also acted on advice from the experts at the state and national level as well as from our peak body, the Aboriginal Health and Medical Research Council. Biripi also has services and out-of-home care and aged care, and that also helped us to maintain those services as well. So RDN played a very big role in that, and we were very grateful, and as with the community. So thanks. Adding on to that, what had to change to stay open and keep our frontline healthcare workers and community safe? Phone consultations and telehealth helped in providing our medical services and local rapid response funds for our elderly, chronically ill and vulnerable people were able to access food and hygiene packs. Education and messages were also provided for communities to stay informed and safe. Our transport team and workers from some of our face-to-face community programs were employed to assist our GPs and other Awabakal staff to give medication to clients. This included nicotine replacement therapy to help community members to quit. These staff helped fax scripts to chemists and did door-to-door drops at people's homes. Social distancing was still being adhered to while meeting community needs. Changing the ways we work at Awabakal has helped people to access what they need, providing ongoing work for staff to sustain their incomes and provided an opportunity to visit and check on our community and clients. So again, another story, our service out of Walgett, where members had to adapt, innovate and be resilient. Mrs. Christine Corby, the CEO of the Walgett AMS, said, "My staff have done a wonderful job under extremely difficult circumstances to ensure the community have access to quality healthcare. We have had to make a few adjustments to our daily activities. Staff have been allocated tasks that are not part of the general routine. Staff have been doing regular welfare checks and delivering food and medicines to our most vulnerable clients. There is an activity that WAMS does not normally provide to the community, but we have had to modify our operation to best support community in the time of," he said. The Centre for Aboriginal Health, in collaboration with the Aboriginal Health and Medical Research Council of New South Wales, have worked together to ensure food security for communities. Through this partnership, over 23 organisations and many individual community members have received Woolworths basic boxes. This is another good news story from Waminda, one of our members in Nowra on the far south coast. Waminda wanted to support parents to keep kids feeling engaged, having fun, and help them express and telling stories through art. We also wanted to provide some nurturing activities for older children and adults, such as weaving and story stones, to help adults feel cared for, more connected to self and culture as much as we could, so they feel strong in themselves as parents and elders. The art activities helped people tell their story, their experiences, and express themselves artistically, just as healing is an important part of our therapeutic work at Waminda. We want women and their families to feel hopeful and to create memories with their families at home. Art can be a collective experience that allows us to feel connected to self and to the whole community. So, where to from here? Sincere thanks to many partners and organisations the AH&MRC was able to work with to support our members through the pandemic. We do acknowledge the innovation and resilience of our sector and their incredible achievements throughout COVID-19. Investments in the Aboriginal community-controlled health sector pay enormous dividends. The ability to maintain delivery of comprehensive primary health care will reduce the longer-term impact of chronic conditions that would not otherwise have been managed for months on end. The challenge to minimise the fourth wave. COVID has given us the opportunity for blue sky thinking. Where do we want to be post-COVID-19? Let's continue to work together and prepare for the future and prepare proactively for future challenges. This is just a message. COVID-19, slow the spread. So thanks to people who have registered and sent in some questions. We've got 4 questions here and I'll do my best to answer. So question number 1 is, what lessons have the staff learned during COVID-19 and will change the way they work post-COVID-19? So it was a holistic approach. Our COVID-19 had staff from multiple departments, public health, communications, business development, and the cultural group. And this really strengthened our approach. The importance of evaluation was really important. So fortunately, we did a formal internal evaluation of our approach to the H1N1 pandemic. And this really informed our approach in 2020. For example, we noted in 2009 there were not enough Aboriginal spokespersons. So this year we really focused on that aspect of our communications through Dr. Calvin Kong, as you saw in the presentation, our member CEOs, and Tyson Demos from the Illawarra Hawks, who also had some promotional videos. They've all had their voices shared as well. So we are currently undertaking a substantial formal internal evaluation of our approach in 2020. This will inform our approach to future pandemics. Question number: AH&MRC recently appointed a new CEO. What does the future of the AH&MRC look like? The future is very bright. There is an innovation that was forced on our sector by the COVID-19 pandemic. We have great staff within the AH&MRC, and that was that was shown in assisting the members to stay open and provide the best possible care. We do have a strong focus post-COVID-19, including helping our services to work on new business service delivery models. We're always looking at ways that we can strengthen our relationships with our members and build on the good work and continue to develop. Our college will also develop in the future. At the moment, we are delivering qualifications, training, in drug and alcohol, mental health, and it's a very bright future with the new Close the Gap strategy to be announced later on during the year. So it's very good, very bright. Question number 3. Many outreach stakeholders can benefit from collaborating with the AH&MRC on different initiatives. What is the best way for different stakeholders, like clinicians, administrators, host facilities, etc., to facilitate this? The easiest way is just to get in touch with us. We're only too eager to come out and help. We need to continue to help services, whether it's our members or within local government and state government, to deliver the best possible services to our communities. in New South Wales. As I said and highlighted in previous slides, that there are 46 members in New South Wales, and as you saw from the map, we are spread across the whole in urban, rural, and remote areas. And this question is: do you have any lessons teaching Aboriginal patients through telehealth? We have seen a rapid rise in telehealth. Almost 10 years of reform has come in as many weeks. As I said previously, the pandemic has forced a lot of change and innovation in our sector as a whole, not only in New South Wales, but nationwide as well. But the AH&MRC has worked closely with the New South Wales RDN to build their capacity in this space, particularly with access to hardware that they need to be able to do telehealth. Anecdotally, many of our members report telehealth has been working really well for our sector. For example, 50% reduction in did not attends, an increase in delivery of 7-1 health assessments were also experienced. We are interested now in key insights and sharing these at a Commonwealth level and advocating for telehealth solutions, MBS numbers that will work for our sector beyond 2020. So there was another question. Given the significant physical and mental toll on some clinicians who have been on the ground helping in environmental disasters and COVID, and in rural areas where some normal services have been put on hold, what are the measures that have been taken and what measures are being considered to allow a recovery time and to have a break? I think this could be a question that the New South Wales RDN could speak on and elaborate more, in particular with support to our member services with the locum support.